Alien hand syndrome and neuronal linkage. What if your own hand started moving without your permission? In alien hand syndrome, the brain motor control network becomes disconnected. This rare neurological disorder reveals a fascinating truth. Uh, movement is not controlled by one brain area alone, but a delicate neuronal linkage between intentions, planning, inhibition, and action. When the regions like supplementary motor area, corpus callosum, parietal cortex, or frontal lobe are damaged, the sense of ownership and voluntary control over the limb can be break down. Hi, my name is Dr. Wes, and today we're going to discuss alien hand syndrome and its neuronal linkage. That is the left hemisphere and right hemisphere, and that is the corpus callosum. A rare disorder where a limb performs involuntary, seemingly purposeful action because the brain agency and motor control networks are disconnected. Initiation. Common triggers of this disease are the stroke, infarction, corpus callosum lesions, mediated frontal lesions, parietal lesions. That is the network injury. Damage affects circuits that normally connect intentions, motor execution, sensory feedback. Patients report my hand moves by itself, it grabs things, or one hand fights the other. Focal lesion, impaired motor agency, autonomous purposeful movement, distress, and functional disability are the major factor of this disease. Normal voluntary hand control or circuits, prefrontal intentions, supplementary motor area, premotor planning, primary motor cortex, spinal cord motor output, and hand movement. These are the normal condition in which the hand is moving. And the basal ganglia. Selections, timing, inhibition of unwanted motor program. Sense of agency, I attended this moment, I initiated, and it can be stopped. That is the major problem with alien hand syndrome. That is the core mechanism, neuronal mechanism. Left hemisphere, right hemisphere, and the lesions at the corpus callosum. Disconnection between the regions of the brain, release of motor program, and the loss of agency. These are the major uh, regions through which the voluntary movements are controlled. But if the lesions are generated in these areas, the involuntary muscle movement gets started and it can't be stopped. Anatomical subtypes, frontal or anterior, grasp reflex, groping, reaching, difficulty releasing object, controlled by AHS, lesions, corpus callosum, especially interior uh, mid-body regions. Posterior AHS lesions, parietal, maybe occipital, thalamic, sensory association network, limb levitation, avoidance, disturbed body schema, and sensory neglect like complaint. Symptoms and beside signs are autonomous movement, object grabbing, intermammal conflict, personification, preserved strength, and distress safety risk. These are the major, you can say, symptoms or the uh, major points occurred in alien hand syndrome. History: stroke, neurosurgery, tumor, neurodegenerative diseases might be play a key role in alien hand syndrome. Logical exam, imaging, MRI, CT, seizure, dystonia, chorea, psychiatric disorders, functional symptoms. Alien hand syndrome is the neurological sign of network disruption. Treatment, treatment called stroke protocol. The patient have to follow the stroke protocols, post-stroke protocols, tumor, aneurysm. It means they have to treat the disease first. Occupational therapy, task-specific training by manual coordination, visual cueing, environmental modification. Behavioral strategies: keep the hand occupied, hold an object every time. Symptoms options: botulinum toxin, movement disorder. Medication may be considered in selected severe cases. Prognosis: good prognosis or better prognosis, small focal stroke with recovery, post-surgical transient symptoms, good rehabilitation response. Guarded prognosis: large colossal frontal lesion, persistent intermanual conflict, cognitive impairment, recurrent vascular disease. Progressive prognosis: corticobasal syndrome, progressive supranuclear palsy, worsening apraxia, and declining independence. That is the summary: brain lesion, network failure, motor release, loss of agency, and clinical AHS. Alien hand syndrome occurs when the brain can still generate hand movement, but the network that assign attention, ownership, and inhibition are disconnected. That is the summary of AHS: disconnection syndrome, breakdown, loss of agency, the limb movement, and the key brain regions: frontal variant, supplementary motor area, neuronal linkage, symptoms, colossal variant, especially corpus callosum, interhemispheric disconnection, and posterior variant. These are the major points that have to be discussed in this regard of alien hand syndrome. Thanks and regards. Please like and subscribe this channel for further discussion on rare diseases. Thanks.